All right, welcome everyone. Thank you for joining us for this best practice webinar on managing cybersecurity during a pandemic. We're going to talk about security and compliance in your remote work environment. We are just seeing everyone enter the webinar now, so we'll give it a couple of minutes and then we'll get things moving along. We'll give it another 30 seconds to a minute or so. All right, so it's about 3 after. I think we can go ahead and kick off the webinar. We can just advance the slide. Again, welcome everyone. Thank you for taking the time to join us. Just want to do a quick round of introductions. I'll start. My name is Preparedness. I'm the Chief Technology Officer at Bluenovo. I've been with Bluenovo for the past 7 years, but prior to that, I was a registered nurse at a hospital in Florida, and I also worked for close to 5 years at NextGen Healthcare, large EHR vendors, many of you know. I'll hand it off to Huzafa for intro.
Hello everybody, my name is Huzafa Desaji. I'm a PharmD. I've been in the FQHC space for about 5 years, working on telehealth and remote patient monitoring projects, and I'm the telehealth and BD lead at Bluenovo, and look forward to connecting with many of you at the end here, should you want to reach out regarding any of our services. So thank you again for attending the webinar.
Thank you, Huzafa. Han?
Yes, nice to be here. My name is Han Ashley. My background is in population health and biochemistry. I've been working with Private Plan and Bluenovo for several years now, and I'm excited to be a part of this webinar. Thank you.
Thank you, Han. And of course, David is going to be the star of the show. He'll be leading us through much of the content during today's presentation. David, you want to just do a quick intro?
Thank you, Fernand. It's David Ginsberg. I'm co-founder and president of Private Plan Associates, but also the lead consultant in cybersecurity for Bluenovo. With Bluenovo, we've been working together for a couple of years now to do cybersecurity, HIPAA privacy, and HIPAA security work on behalf of federally qualified health centers and other Bluenovo clientele. So I think, Fernand, that's enough about me, right?
All right, we'll have plenty of opportunities to chat with you, David, throughout this webinar. A couple of things, and David, if you don't mind, we can advance the slides here. We have quite a bit of topics, and I want to get right to it, but I do encourage everyone to please leverage the chat function in this webinar. Throughout various points of the webinar, we're going to be engaging you in polls. But please let us know via the chat any additional questions you have, any feedback elements you have. This webinar is, of course, being recorded, and we are taking some notes, and we'll be sharing all of it with you following the webinar. So as much as you can, please engage us, ask questions, let us know, what's top of mind for you relative to the topics that we're going to cover. starting with first the urgent threat. So we can advance the slide here, and it'll take us to our first section and first topic around the urgent threat. So Emily, if you could go ahead and bring up our first poll question, and we'll give everyone about 30, 45 seconds or so to cover this. And from here, I'll hand it off to David, who's going to walk us through the rest of the webinar. David?
Well, thank you. And thanks everybody for participating today. We wanted to start with regards to urgent threats that, even though we're here to talk about tips and tricks for working from home, remote workforce activities, the reality is that since the beginning of the COVID pandemic, there has been a huge upswing in the amount of ransomware, email phishing attacks, and related kinds of cyber attacks that have occurred. And just from the poll, we're seeing that right now only one person has had a ransomware attack in the last 12 months. That's good. Of the 17 participants, that's not too bad. One is probably too many. We are seeing in different market sectors that number can be much, much higher and can even go to as much as 10% or more of users in the healthcare space or healthcare organizations have had a ransomware attack in the last 12 months, and in particular in the last, I would say, 6 to 8 months during the lockdown. So typically your ransomware starts with an email phishing scheme. And the phishing scheme, as you can see from the visual, has a bait or a lure and two fish in that circles. And the idea is to dupe a user into thinking an email is real and dupe them into entering and clicking on a link that will download malware, or even worse, duping them into going ahead and moving forward into actually entering a username and a password. Typically, that will be a username or password into their email, their Outlook, from which the email addresses in their address book can get stolen, and often those end up in the dark web and are sold. Indeed, the cyber criminals will sometimes troll through those emails. They'll look at your domain name, because let's say you're Community Care of Greater Las Vegas, and you're a federally qualified health center. Doesn't take much to go online to learn about Community Care of Las Vegas, to go online to find your most recent 990, to even go to a HRSA site. And with a little bit of investigation, I'll know who your CFO is, your CEO is, maybe a few other people. I can go through the emails that I've stolen from you, and I can take a valid email like that of your CFO, and I can then go through their email file, their address book, and I can start sending out malicious emails to dupe other people into either releasing credentials or, worse, paying fake invoices or paying for services that were never performed by duping them into invoice schemes. There's a lot of this that goes around. It typically preys upon us the end of the year, the beginning of the new year, when we're very distracted, busy, getting back from holidays. But that prey has been now within the COVID pandemic even more severe, because we're even more distracted. And for many of us who are working from home, we may not even have the same protections on our systems, email protection, spam filtering, etc., on our devices at home that we do within our organization or our facility. A couple examples of how profound some of these ransomware attacks have been. This is one that hit in California in Simi Valley, where the practice actually ended up closing because they could not really afford to continue business after having lost all of their patient health records. This is a great example of technology that goes wrong. In the day of a paper chart, we would have to have had a fire to wipe out the facility and lose all the charts. Now all we need is ransomware and not being able to get to those files and having them locked, or paying the ransom and still not being able to restore your systems. Another great example was this Michigan-based ENT facility that chose to shut down rather than pay what's relatively a small ransomware in order to buy back those assets and access to their medical files. So we're seeing these kinds of situations, just two examples of hundreds and hundreds that have occurred. What can you do to protect yourself? And we shouldn't think that federally qualified health centers are immune. In fact, there is a very, very well-known case of a large federally qualified health center in Colorado that had a ransomware attack and had an attack where an individual clicked on a link. The link looked to them like a legitimate link from a community church that this individual goes to, and they entered, unfortunately, being distracted, their username and credentials, and their entire email address got exposed. Well, in this case, the email PST file got sent to an IP address in basically a Soviet country. We didn't know whether the data was actually compromised or not, but going through the data, some 10,000+ messages, it was clear that there was PHI in many of those messages, that there was internal emails about a patient, perhaps about revenue cycle, perhaps about population health, any number of situations, PHI being present. So there was a very, very significant amount of investigation that had to be reported to the Department of Health and Human Services Office for Civil Rights. And that started a 5+ year investigation that culminated and ended up in a profound penalty, financial penalty for the organization. Penalty was initially, as a fine, more than $2 million, and it got negotiated down to $450,000. Still, as you can imagine, if you're at FQHC, a huge hit. How do you protect your practice, or how do you protect your organization if you're a hospital or a federally qualified health center? Well, there's some very, very basic tips that are good IT cybersecurity things in general, and some are very specific to phishing and email phishing and ransomware schemes. Certainly requiring strong passwords and frequent changes of those passwords. So a password that gets stolen today should not be a password that would still be in use a year from now. Perhaps on the other side of this screen, even more important is multi-factor authentication. This has really become the best practice, not just a password, but some other factor, something that you know. It could be a link that you click on and then you have sent to your cell phone a code or an email code, or it could be those CAPTCHA requirements that require you to look at a screen and choose the right images, or it could be a fob that you carry, something that you have. But it's a second factor to what you know. What you know is your password. Once your password is compromised, your whole system's compromisable. But if you require a second factor, the bad guys can only get in while they've got that system open. Once it logs off, they can't get back in again. Then, of course, using secure email domains with good spam protection. Most organizations have migrated now to Microsoft Office Exchange and or to the Microsoft Cloud version of Office 365, or they're using G Suite Business, which is now called Google Workspace. Those are both very good products, but they can be enhanced. In fact, we believe and suggest that even those email systems can be further improved by adding stronger spam protection, encryption protection, and working with a vendor or vendors for your spam protection who are constantly looking at the cyber threats and the phishing threats that occur and providing sophisticated threat detection as a built-in part of your email environment. Of course, training and training and training and training and training. We can't emphasize this enough, to get your users aware of the threats of phishing, using your own email phishing testing, if you will, in order to simulate an attack, which is one of the best ways to change behaviors, and doing that with enough sufficiency, enough regularity, that we really all get into the accustomed use of phishing and become very suspicious of our emails. There's really no better way from a behavioral perspective, from what we like to call in technology social engineering. There's no better way in social engineering than to increase awareness so that we're more vigilant. And periodic testing does just that.
And sorry, here real quick, David, if you don't mind, just a couple of things to add, with regards to that slide. For passwords, the standard has been changing over the past several years. I think now the latest recommendation is that passwords be longer. I think 12 plus characters, and as opposed to being changed more regularly, actually increase the duration in which you're changing them to just make them longer. And then the piece around single sign-on and MFA, I think multifactorial authentication are just naturally a little bit more disruptive from a workflow standpoint. So when you select a solution for that, just make sure that it's one that works well in the context of a clinic workflow, that you're not adding too much additional burden to the providers, and really think through the lockout intervals of your system. And then last, I think with regards to the single sign-on piece, looking at potentially deploying an Imprivata type solution where you can have staff badge in so that the long passwords become less and less of an issue. That's all for now. Thank you, David, for that first section. Now we're going to switch gears a little bit to talk about HIPAA. Emily, do you mind bringing up the second poll question for us, please? All right. Okay, David, I'll hand it off to you.
Thank you. Well, the prelude to this section is that, as we, of course, all know and are woefully aware of, we're in the midst of a pandemic. And in March, there were a number of agency information released from the Department of Health and Human Services regarding what's called enforcement discretion for HIPAA during the COVID-19 nationwide public health emergency. And of course, that emergency is still in effect. And the enforcement discretion was released by the Department of Health and Human Services to make it easier for organizations to do telemedicine without necessarily the burdens of HIPAA compliance, in particular, maintaining and having, during that time frame, a HIPAA business associate agreement with your vendor. Prior to the pandemic, there were vendors like Zoom that did not automatically encrypt the email and the video presentations and the chats that were occurring during the Zoom meeting. But you could get that if you purchased the healthcare or professional version, which is a lot more expensive, of that platform. And then you could get a business associate agreement, which a number of FQHCs did. So this regulation was designed to make it a little easier during the nationwide emergency to allow organizations not to have to use a BA. Now, it's great to see that of the respondents, 9 have a BA in place with your vendor, 5 of you aren't sure. And it may be that many of us are not sure because for so many, you put together your various telemedicine systems very, very quickly in order to just meet the emergency without really putting a lot of time and energy into doing much more than that at that particular point. So you had to get things going, you had to make it work. So basically, I'm sorry, I'm hitting my slides a little too fast. So you had to just do a lot in a short period of time. So what the actual enforcement provision says is that if you want to use audio or video communication to provide telehealth to patients, you can use any non-public facing remote communication product. Now that's really very important, non-public facing, and that you can move forward as long as in good faith, you're providing these systems using non-public facing video. Now, this is not a get out of jail free card forever. 6 to 9 months into the pandemic, if you don't now have a BA in place and are using a product that is secure or that you can have a business associate agreement to determine and show that it's secure, it's really, you've got enough time, you should getting that in place at this particular point. But certainly during the pandemic, there is some enforcement discretion. During this particular notice, there was a lot of good guidance that came from the Office of Civil Rights. So they also noted that you could use popular apps like FaceTime. FaceTime is fully encrypted, Facebook Messenger video chat, Google Hangout, Skype, which is encrypted, or another one of my favorites, WhatsApp, which is fully encrypted end to end as well as your video and voice communication platform that would protect those conversations from prying ears. Interesting enough, though, the Department of Health and Human Services encourage people to notify patients that if you were using an app, especially one that you might not have a BA with, that that app could be vulnerable and that you should at least notify the patient that you'll do everything you can to enable all of the encryption and privacy modes within that system. Now, this is critical. Facebook Live, Twitch, TikTok, and similar communication that is public facing, there was no get out of jail free card for these. They cannot be used. And here's what we're worried about. Again, 6 to 9 months into the pandemic, you have a provider workforce that's external. You may even have, as an FQHC, workforce that are perhaps not providers, but perhaps they're medical assistants, or they are other clinicians that are still working from home, doing telehealth visits, could be even around population health and not specifically a telemedicine visit. And they may have just fallen back to using familiar technologies without checking back in with you to see if those are appropriate. So be sure to remind your staff and have strong work from home policies that make it very clear they're not allowed to use these public-facing systems. So again, with the enforcement discretion, there is discretion around those technologies that are HIPAA compliant will sign a BAA rather. Those are always the ones that you should choose in any case, right? Even though you've got an enforcement discretion, at some point, the COVID pandemic will be over and you'll continue to be doing telemedicine. You don't want to forget to get that BA in place then. And then there are some other areas that we do want to talk to. Now, I think I might have jumped a slide here. I guess not. Okay, so again, the discretion is in place around the enforcement and the enforcement actions. As far as HIPAA and telemedicine is concerned, there's another nuance, and that nuance is around access. So patients who are no longer coming into your facility because they're getting perhaps their new visit done by telemedicine may not be seeing and signing all of the normal forms that they typically sign, or that process may be somewhat impaired, and they may not necessarily sign the notice of privacy practices acknowledgement, or they may not read it. We've noted that there's been a general lapse in the last few years with understanding what HIPAA requires in terms of creating an open environment for your patients to get access, whether that be copies or the ability to inspect their own protected health information, their own information that we say within the HIPAA world typically is stored within a HIPAA designated record set. And there's been several recent settlements of organizations that have not necessarily provided the appropriate access in a timely fashion to patients when they've requested their own information. Specifically, not that they didn't respond and provide that information, but they didn't provide all of the information. As in this particular case on the screen right now, where an orthopedic and neurosurgical facility forgot or did not provide the imaging along with their medical records. Now, why is this a work from home kind of pandemic concern for us right now? We are seeing reductions in staff amongst our FQHCs. often reduction in the medical records, health information management area. We're seeing difficulties sometimes having a centralized environment where you have staff in place. We know that there are strains on workforce. Those strains are going to continue throughout the pandemic, throughout this next wave, in terms of not everybody being at work at the same time, people getting sick, being off for days. And this is an area where a medical records person perhaps could start working on a request, pull all the data out of your eClinical Works, your GE Centricity, your NextGen, whatever platform you're using, and then just have the imaging that they need to get, God forbid, get sick, be gone for 2 weeks, come back and not remember to follow up. And here you've got a HIPAA violation. Little things like that that are concerns in terms of the process, why we bring it up. And this is a similar situation that occurred with a fairly large hospital system based in Phoenix, similar kind of issue. So the enforcement actions are designed under this area, this access or barrier to access, to remind healthcare providers of the necessity to provide patients the information that they need about their own healthcare and to provide appropriate access. Within HIPAA, a patient can even ask you for an electronic version of their protected health information that you store in a designated record set. And they can even ask you for that in a file and format of their choosing. So they might say, I want a PDF. They might say, I want an XML file, or I want a JSON file that I can put into my homegrown system. And if you can produce it, you have to. If you can't produce it, you negotiate with the patient and provide them an alternative for that particular access requirement. So again, here's a little note just from the director of the OCR that this is a fairly important situation for them, allowing patients appropriate right to their medical records and information, regardless of the setting, and even during a pandemic. So we'll take a short break here and queue up the next poll. Fernand, do you have anything else to add to what we just discussed?
No, I think you covered it well. No additional.
Now, why are we asking this question? Well, unfortunately, we know we're in the pandemic, and at least from the clientele that we have at Blue Novo and with Private Plan, we know that the idea of remote workforce and working from home is here to stay. And there's various guesses and predictions about how much will remain even after the pandemic is over. And before the next pandemic, God forbid, comes along, that we may be moving to a far more virtual workforce. Well, for many of us, we've been working virtually for quite some time, but even within the health center FQHC world, we may still be doing that for many, many reasons because of getting accustomed to this and the availability of good technology, and our patients perhaps preferring this in many ways as a way for them to work. So we wanted to get a sense of what you thought your workforce would look like from a remote perspective in the next 13 months, if you will, 14 months, I guess, through 2021. And I think this is a very interesting poll that shows that 8% of you are thinking that still about 50 to 75% of your workforce will be remote in that particular period of time. That's a fairly stunning number. And I think we see that through a lot of different polls and different industry guidance that we're seeing, which means we better figure out how to work remotely and protect yourself as much as possible. So now we get to a little more of a technical review of the work from home environment. So again, as I said earlier, many of us scrambled in March to put together work from home. You deployed workstations, you gave your workers the right to come in perhaps through a secure Citrix front end or a VPN, use their own personal device. You anticipated people be working from home. But for many of us, we didn't think that through very carefully. We've got a very interesting situation that we encountered with one of our customers where there really wasn't a private space for them to work from home and doing revenue cycle operations. And some of those conversations with patients were overheard, and then later those are inappropriately shared, thus a HIPAA violation. We've got other situations that have occurred where the home environment is basically an insecure one technically because the Wi-Fi and the workstation was one that was shared by family members with a shared login, and it was not a secure machine. So if you're working from home or if your workforce is positioned from home, what is really necessary? We think at the first step, secure Wi-Fi. And there's many flavors of your Wi-Fi. Wi-Fi should be encrypted at the minimum with a WPA2 encryption key. And if that key is what's written on the back of your Comcast or whomever router that they supply it with you, we always recommend go ahead, change that key, make it even stronger, and be sure that you keep that key somewhat secret so it's only known to a few individuals. Working from home in a private area is, from a HIPAA privacy perspective, critical. So there isn't an opportunity for shoulder surfing, or as we said in that little incident just before, overhearing a conversation. Get in the habit of logging off when you get up and leave your workstation or even your smartphone so that it can't be seen by a family member, by your spouse, or another roommate that might be in your environment. And the proverbial sticky note, which is a problem even in your health centers where individuals will write down their complex password and stick it in the front drawer or underneath their keyboard. The same prohibition should occur at home. Don't keep those easily written and easily identified. And unless your IT department has said you can use a personal computer, we really think that is asking for too much insecurity. That computer may have malware, it may not be getting patched on a regular basis, it may have insecure connections, it might have a USB port that data can be copied to, so on and so forth. And there is the USB port. We think there's no reason ever to save data on media when you're working from home on a USB drive unless you are permitted to do that. And there's a reason in your job role for that. And of course, many of us have printers. If you are going to be conducting any patient business or patient care and you print something out, please be sure that that printer is within your line of sight in your office at home or where you work from, that you take that paper off, put it in a file folder, turn it over so that it cannot be overseen easily by anybody else. And of course, the same restrictions on texting and email should apply for home use as they do at your medical practice or at your FQHC. And a little nuance here, many of us have our home devices. In fact, you may have one, I like to call her the A word, or you might have a Google Nest, you might have Siri on your cell phone. These could often be in listen mode. While there is no direct evidence that they are recording everything you're saying and pushing that up to the web, they are recording some things in order to take a cue in terms of activating. We think the wisest path is just to disable them during your sessions where you may be talking to a patient or doing any kind of business, or not work in an area that could be overheard by these devices. Generally, you have a lot of controls in your telemedicine and telework platform. So whether you're using Zoom like we're doing today, GoToMeeting, WebEx, BlueJeans, or any of these larger commercial platforms, you have the ability to ensure that end-to-end encryption is turned on, should always be turned on. You have the ability to issue a password to the participant. That means nobody else can get in and Zoom bomb you. So Zoom bomb has become a new term in our common vocabulary, right? So how do you protect from Zoom bombing? Well, require a password to sensitive meetings or conversations so nobody else can get in. Creating a waiting room. Now, this is an interesting process. In fact, we like some of the telemedicine platforms that are not listed on this screen here that are more physician and healthcare centric that actually follow the workflow that you have in the office, where you'll have a medical assistant or receptionist intake a patient electronically through the virtual waiting room, keep them there. Then the provider gets in, he brings the patient out of the waiting room, he or she treats the patient through your telemedicine, and they close that session. The patient goes back then to quote a discharge room where somebody will work on their referral follow-ups, payment, things of that nature virtually, and then the session is closed entirely for that particular patient. Great services that will allow you to replicate a workflow to ensure the maximum amount of patient security. Restricting chats, locking a session once it's started, disabling the patient or participant from recording, and even temporarily pausing a screen when a new window is open. So sometimes when you'll change windows in your GoToMeetings or these other platforms, you'll basically stop showing what you've been showing, and they may be able to see the rest of your display and other systems. And while that more often has simply been embarrassing for a lot of users, it could also show data that they shouldn't be able to see. So these are just some very good teleworking and telemedicine protocols to enable whether you're working with a provider or you're working with administrative staff. Then there's the HIPAA privacy component of telemedicine. We think it's important, at least in the first encounter, to ask and document the patient's consent to use that technology. It is not specifically required by HIPAA, except for a new patient, you do need to get their acknowledgement of your notice of privacy practices. We think it's very good to ask the patient if they're in a private area and confirm for them that they're comfortable continuing if not. And then do good documentation of the time, start and end time of your sessions, especially be prepared. If you're not already, as you may know, January 1st, there is an entirely huge, the first in almost 30 years, upgrade to the CPT evaluative and management codes, which puts even more pressure on understanding the time that you spent with the patient. So we're going to shift subjects again, and I think we're going to have another poll coming up at this point.
Awesome. And while we pull that next question up, just a couple of things to add from a best practices perspective. Just making sure that we're not using things like Dropbox. Although there is now, I think, a HIPAA secure encrypted Dropbox version to look to ensure that your staff are at least using that versus the free Dropbox instance. And really the best practice is to look at deploying some sort of secure file transfer protocol process to be able to transmit PHI, patient sensitive data to and from your patients or business partners. And then the other piece I think is with regards to the use of VPN and just making sure that you have the appropriate considerations when connecting with any interfaces or any third party. All right, looks like we have our results in. David?
Thank you, Fernand. Yeah, very interesting that about 53% of the attendees think that you can improve your risk and compliance posture. That's fabulous. That's a very, I think, honest rating. And we think that would probably be pretty reflective in the industry that somewhere between 50 to 60% have room for improvement. And I do think it's true that about 10 to 15% now have a very excellent security posture. That number was never the case up until a couple years back. We think that that number always hovered around 3 to 5%, but we think it is fair that many of you do have an excellent and good HIPAA security and privacy posture. So let's talk just a little bit about this particular part of compliance to this as we move through these next slides. So we had spent a fair bit of time about that access capability, the ability to access medical records and giving patients that right and being sure you're giving them all the information they need. If you haven't done a recent HIPAA and general privacy review, then you may not know some of the areas that you are not completely up to date or efficient in terms of providing right to access or in terms of being sure that you're following the proper procedures and protocols that may have been in place but might have become diminished over the years and changes in leadership, changes in compliance officials, and so forth. Which is why we think considering the conducting of a privacy review is critical. One more component of this, Han Ashley, who's participating today, has spent a fair bit of time doing data mapping, and not just protected health information, but also personally identifiable information mapping at FQHCs to really help give insight into where data might be stored. In fact, the recent Blackbaud breach, if any of you use Blackbaud for donor engagement, showed that there are many, many organizations that use Blackbaud as a donor management system that didn't realize that their fundraising or development staff were actually putting indicators in their razor's edge donor management software that indicated that that donor was also a patient and even had information that was additional information that could be construed to be protected health information. So we think a privacy review should go hand in glove with updating your data map and identifying the various systems that you have that might even be a one-off, maybe only used by one person in the organization, maybe used by somebody in the C-suite, that potentially have data that could expose your organization in a privacy compromise. Key areas to look at in your privacy review should be, are you still handling the notice of privacy practices correctly, especially in the era of telemedicine, the right to access, which we talked about, the right to give the patient the ability to restrict access to others to their health records, the right to amend, the right to an accounting, and then understanding the regulations requirements for complaint handling and minimum necessary. These are all very key areas within the privacy rule that we think every organization at this particular juncture in 2020, coming into 2021, should be reevaluating from the perspective of, are you still compliant? And have you done your risk analysis? So the risk analysis doesn't have to be done every year, but if you are still participating in the Promoting Interoperability program, what we used to call meaningful use, you have to do it at least during your reporting period, which for most of us would be done on an every year basis. So if you haven't done your risk analysis, it's something Blue Novo can do for you, or you can use the ONC toolkit, do it yourself, have another IT vendor, hire a consultant, and so forth. We just think it's very important to remember that the security risk analysis should be an ongoing living part of your risk management program. And Blue Novo about and their expertise as IT, outsourced IT professionals, CIOs, how they see risk management as just an ongoing part of the fabric of your security environment. So Fernand, I know I'm putting you on the spot, but maybe you might want to give a few words about how you see that from the CIO's perspective.
Yeah, absolutely. I mean, I think, from the perspective of liability and cybersecurity insurance, just making sure that you have the proper technologies in place, and then also the configuration of what you currently have deployed are all things that protect your organization and not necessarily puts it at risk. And we can definitely work with, any amount of, clients and the needs that you have. Definitely let us know if there's any SRAs or any remediation work that you're looking for any assistance on, and we're happy to sort of facilitate that call. On this slide, we actually have Huzefa's contact information listed. Please don't hesitate to shoot him an email or reach out to him via phone, and we can definitely have that discussion. So I think this is a good spot to sort of just query the group to see if there's any additional questions. Thank you for those of you who did submit your feedback and questions. I think we got back to all of you directly via the chat. But anything else, David, either from your end, Huzefa or Han, that you would like to sort of share with the group while we wait for the last questions coming up?
Yeah, this is Huzefa. I'm just going to say a few things, a couple of things. And David, thank you so much for all of the information, especially pertaining to telehealth. We totally understand that FQs, when the pandemic hit, overnight, you literally had to switch to virtual visits. And if you are currently, on a platform that is non-HIPAA compliant that you just use right now, like let's say FaceTime or Zoom or some other telehealth platform, I would urge you to start thinking about strategically as we move forward to think about a more long-term solution. I know many of you are probably already on that path. But if some of you are not and you're still using those non-HIPAA compliant methods to reach your patients virtually, then please start thinking about that. And if there's any help that we can provide in that direction, please reach out to me, as Fernand mentioned, or any of the other areas around SRAs and cybersecurity. We're happy to be able to help. So. That's it for me. I'll open it up to anything, Han, if you wanted to say anything.
I'd like to add that this is a great opportunity for everyone who's attending as well to consider retraining and refreshing all of your workforce that is working from home and updating those policies and procedures and making sure that they understand the risks from working from home and all of those safeguards that David described today and reinforcing those. So thank you.
And I might add, Fernand, another note here. We didn't embed it in today's presentation because it would have taken us down a rabbit hole and required a whole hour of its own. But some of you may be aware of the Office of the National Coordinator's requirements under something called the 21st Century Cures Act, and the requirements that everybody, they call them actors, comply with the information blocking rule. So very, very quickly, the information blocking rule is a rule designed to enable a freer flow of information between healthcare providers, health information exchanges, vendors, etc. And there are penalties attached with not supporting good information flow. We're actually going to be putting a small webinar together for the Hawaii PCA on this subject shortly, and something we could, if you're interested, provide additional information to. There's a couple of you that I see as attendees are going to be and are part of the Colorado Rural Health Center. You're going to hear this in one of my presentations if you are attending on Thursday. But the information blocking requirement does work hand in glove with the privacy rule and with various components of the security rule to ensure that a patient has access to their protected health information from the systems that you're using, like your eClinicalWorks, your NextGen, your Athena, whatever the system might be, and that information is not blocked through any unusual barrier, either for cost or for significant difficulty in registration and so forth. So very, very little teasing, if you will, of what that requires, but please be on the lookout. There will need to be some creation or updating of your existing HIPAA privacy policies and procedures to coordinate with the ONC information blocking regulation. Thank you, Fernand.
Awesome. All right. I guess if there's no additional questions or comments from the group, we can give back 9 minutes of your time. I want to take this moment to thank you all for joining us for today's webinar. Please be on the lookout for subsequent webinars like David mentioned, and please reach out if there's anything that we can help you with. Thank you, everyone, and hope you have a good rest of your day. Take care.